Hey guys, Dr. Micah here with Renew Specialty Group. I'm one of the lead nurse practitioners here in Cornelius, North Carolina. We are very lucky to have with us today Bill. Bill is the founder of Phallofill out of Dallas, Texas. We've been doing treatments all day. We're going to talk a little bit about the procedure, what Bill has coined, and kind of go from there. Bill, tell us to start, how is this procedure different than other growth enhancement or girth enhancement procedures out there?
Great, yeah. So first of all, we're using a hyaluronic acid dermal filler, which is an FDA cleared dermal filler that's made to be used in the face. So what you're used to seeing for tear troughs and for lips and for nasolabial folds, cheeks, that sort of thing. But we're using it as an off-label procedure, just like it's used in many other off-label procedures within the body, but we're using it specifically in the penis to enhance the girth. There's many other procedures that are out there that use non-FDA cleared dermal fillers that really aren't even made to be used in the body, such as silicone, or this other product that's called PMMA, which is basically acrylic beads that's used to plump the skin. Those have all kinds of side effects. They cause granulomas. They have a high infection rate. They're permanent. Anyone that hears the word permanent when it comes to dermal fillers should stand up, turn around and walk out of the practice, because a permanent dermal filler is a permanent problem when it migrates or when it causes a complication. So you definitely don't want a permanent filler. I know it sounds good, but you don't want a permanent filler put into your body because things can happen over the course of your lifetime. So we're using an FDA cleared temporary dermal filler that gives us a longevity of about 3 to 4 years because of the place that we inject it into the body. We at Phallofill teach the providers, such as Dr. Micah, how to inject it into a particular plane in the penis that keeps the longevity at about 3 to 4 years, because the plane that we inject it into doesn't have any lymphatic drainage and doesn't have any blood flow. So that's how we get our longevity in the penis compared to the year that you may be used to when you hear about a dermal filler being injected into the cheeks. The next thing that sort of sets us apart is that Phallofill has designed and patented a post-care garment that we put on after the procedure. And that procedure is going to maintain the placement of the dermal filler because of this post-care garment. And no one else in the world has developed a post-care garment specific to penile girth enhancement. It is patented. It's in the process of being FDA cleared on label for girth enhancement. It is an FDA registered medical device at this point, but we're really happy and proud of our post-care garment and our injection technique.
So Bill, two of the big questions that we got. The first one is the procedure painful? And then secondly, how long is my recovery period?
Well, so the patient that we just injected, as you just saw, I asked him on a scale of 1 to 10, where would you put the pain level? Pain being the least amount of pain that you can imagine, and 10 being the worst amount of pain that you can imagine. And he said around a 2 or a 3. Most of the time, my patients tell me it's a 2. 2 is the most common answer. So there's really not that much pain involved in the procedure. There's a lot of anxiety that's involved whenever the patient first comes in, because they've never had a needle in their penis before, and that sounds very scary. But the way that we use lidocaine prior to the procedure so that they don't feel anything during the treatment makes it very comfortable.
You had a conversation with him during the entire procedure as well.
Oh yeah, we talked.
You could see in his face he had no pain or irritation on his face. Yeah.
We talked about Dallas, which is where I'm from. We talked about he wanted to visit. We talked about the things to do there.
He was very comfortable.
Yeah, we had a nice conversation. So it is not an uncomfortable procedure. You're going to be at ease as soon as the procedure starts, and you won't have any anxiety whenever you come in for the next procedure. Now, as far as recovery, we ask you to abstain from sex for 10 days, and that's really because, for one, we don't want to have any fluids or bodily fluids get into these open injection sites. So we don't want you to have sex because we don't want to put you at risk of an infection. But even more importantly is that we don't want the dermal filler to migrate or to be pushed through the shaft of the penis. Even so, we put the sleeve on, and the sleeve holds it in place. After 10 days of wearing the sleeve, the filler is encapsulated enough in order to take it off and have sex, and then put the sleeve right back on. We're going to wear this post-care garment for about 3 weeks after the procedure, And you're gonna wear it 24 hours a day. It's not uncomfortable. You can't see it through your clothes. You're gonna shower in it. You're gonna sleep in it. It really is easy to use. It's actually so easy to wear that we've actually had patients ask us after the procedure was finished if they could get another post-care garment because they actually liked the way that it looks sometimes in their crotch, because it can sometimes make you look like you have more in your crotch than what you actually have. So maybe one day you can see these things on Amazon, who knows?
So Bill, tell me a little bit about how the actual procedure is performed.
Well, first of all, whenever the patient comes in for the very first time for their consultation, we're going to measure the patient. We're going to show them on our little prop set what their girth is, and we're going to ask them what goal that they have in mind, so we can sort of talk about how much dermal filler is going to be needed for the process, so that they have an idea of what they're getting themselves into financially. And then we take some before photographs because we want to be able to monitor the progress so that you can see the changes each time that you come in. And we are expecting about 1/4 to 1/3 of an inch with every procedure. So if you want to have an inch increase in girth, you're looking at probably about 4 sessions. And then the number of syringes that we're going to need are actually determined on the length of your penis. If you have a longer penis, it takes more dermal filler to get down the shaft of the penis. If your penis is shorter, it's not going to take quite as much dermal filler. So a shorter penis is going to get girthier for less money, and a longer penis is going to require, unfortunately, a little bit more syringes of dermal filler to get that same girth. So after we determine the syringes, we've got the photographs taken, we're going to start prepping the patient. We're going to use a cleanser that's going to keep them sanitized or keep their skin clean for about 24 hours. And then we're going to make some marks on the penis so for us to sort of determine where we're going to lay the dermal filler in this particular patient, because all anatomies are different. We're going to start with some lidocaine. We're going to get the penis numbed, and then we're going to very meticulously lay the dermal filler into the appropriate place into the penis that's going to add the girth in the areas that we want. We're going to clean them up afterwards with some alcohol pads and put their post-care garment on and send them on their way with a set of post-care instructions.
Very cool.
I just want to make a few comments here that I've noticed since I've been here today with Renew. So first of all, Dr. Micah has got the most amazing staff. When I first came in, I was greeted at the front desk by the receptionist and maybe patient coordinators. Very warm welcome. I didn't know if that was just for me or if that's the way that everyone has been welcomed, but then as I've listened to the patients who've come through here, they have bragged over and over about the staff that you have here, and I would like to commend you on having such an amazing staff, amazing and caring staff with such good bedside manner. You know, the patients talking about they get a follow-up call the next day. That's not often that you get a follow-up call the very next day after a procedure. You know, a lot of times the patient is treated and they're forgotten about until they come back in the next time and drop some more cash. But you guys are following up with them. Your bedside manner is second to none. And you know, I go into procedures and with providers, and I developed this procedure, I teach this procedure. So Dr. Micah, you know, was trained in Dallas with me, and then I come back and I do a follow-up a few months after they've been practicing, and his technique is spot on. I did not have to do any type of correction. I was astounded at the results of the patients. I did not see one patient that has come through here today that needed to have any type of correction done. They've all been so meticulously treated, and they have such an undetectable, realistic result. I'm just really happy with what I see here. And so anyone who's watching here and they think, well, you know, all providers are not the same, you're right, they're not all the same. But this one here in North Carolina, this is a guy to come to. I highly recommend him.